Hello, my name is Dr. O'Malley, and today we'll be going over the cranial nerves, its functions, and a test to see which nerve you may have damaged. Up first, we have the olfactory nerve 1. Its function is sense of smell. The test I would perform would be to test their sense of smell by blindfolding or covering their eyes and having them smell a common scent like lavender or vanilla. Our second nerve we'll be testing today is optic nerve 2. Its function is vision. For the test today, I'll be having the patient stand 10 to 15 steps away and have them read off a chart that has big and small letters and numbers. Our third nerve that we'll be testing today is the oculomotor nerve 3. The function for this is eye movement. For this test, I will be moving a pen back and forth in front of the patient's eyes and assessing them. Up next, we have the trochlear nerve 4. Again, the function is eye movement, but specifically the superior oblique muscle. For this test, I'll perform a similar test as the oculomotor nerve, but this time we'll be using a flashlight and having the patient follow the flashlight as it goes up and down and side to side. Up next is the trigeminal nerve 5. Its function is the sensation in the face and chewing. This test, I will be using a technique called face tapping, which is simply tapping the patient's face with a cotton ball or swab. Up next is the abducens nerve 6. Its function is eye movement, specifically in the lateral rectus muscle. For this test, I will be testing the patient's eye by moving a pen up and down and horizontally. Next, we have the facial nerve 7. Its function is facial expression and aids in taste. For this test, I will be having the patient taste a mint and put them through a series of facial expressions like smiling and frowning and assessing them from that test. Our next nerve is the vestibulocochlear nerve 8. Its function is hearing and balance. For this test, I'll be having the patient balance by having them stand on one leg for 7 seconds each. Up next, we have the glossopharyngeal nerve 9. Its function is swallowing and taste. For this test, I would first examine their throat with a light, and then have them drink a glass of water and observe their reaction. Next, we have the vagus nerve 10. Its function is it's a mixed cranial nerve on the sensory side, so its function is to acquire sensory information from the throat, digestive, and cardiovascular organs. And it also transmits motor commands from digestive and respiratory organs. For this test, I would use a soft cotton swab and tickle the back of the patient's throat and see if they get a reaction. Our next nerve is the accessory nerve 11. Its function is shoulder shrugging and head movement. For this test, I would test the patient's ability to shrug the shoulders by having them shrug them with no resistance and then with resistance. I would also have the patient rotate their head and have them hyperextend it and access it from there. Lastly, we have the hypoglossal nerve 12. Its function is tongue movement. For this test, I would simply have the patient stick out their tongue and move side to side and up and down.